says if a patient is a candidate, then then it's just straight through all the way a beneficial program. If the patient's not a candidate, tell them what the program's about. It's a medically sound exercise program, which is administered by a physical therapist, and we do this. We conduct different kinds of tests. We conduct for flexibility, the sit-reach test. We conduct a body fat test. We conduct a blood glucose test. We do your heart rate monitoring, with heart rate monitors, which the patient wears while you're training, and we make sure you lose weight in a safe and effective way. And there's a nutritional component, which is discussed by a registered dietitian. That then becomes a separate cash-based program when you present it correctly. Let me go back to my example about the guy who needs to lose 5 pounds. Okay? The guy wants to lose 5 pounds, he has an ankle injury. You're treating him for his ankle, but he's a professional athlete. Now, you're putting him or him on a treadmill. Do you think that's covered? Do you think that's reimbursable? Let me be more specific. He's a professional athlete who's now he's nervous about getting back into sports, and you're getting him back on the treadmill. He's back on the treadmill for the first time, doing it for the first day after 2 weeks of rehab for his ankle. Is that potentially reimbursable?
Potentially, yeah.
You bet it is.
Yeah. But I guess, so just to be clear, if it's a maintenance program, right, then that has to be a cash-based program. If it's a patient, let's say, it's just physicality, weight, monitor blood pressure, monitor weight loss, you monitor that the person's function is improving, and maybe their low back pain is diminishing with the entire program. That is reimbursable.
True.
What you're saying.
True. But the components you just mentioned are components of both the reimbursable program and the cash-based program.
They can go either.
Yeah, the program itself is the same,
Right.
whether it's reimbursed or whether it's cash-based. But you're right.
Maintenance definitively is cash-based. But if you can document in your notes that I'm just trying to reiterate what you said. You can document in your notes that their low back pain is decreasing in the program. Maybe their blood pressure is getting better. Maybe their function is improving in general. Then that would be reimbursed.
Yeah, the objective measurements have to be justified by functional improvements. We can't just say the patient's body fat improved. I mean, that's a nice thing, but what did it do for them?
But is that, body, let's say just their body fat or their blood pressure went down, is that a physical therapy? No. So
That's the answer to your question.
So then the true situation is not so much that their blood pressure is going down or their body fat is going down, it's that their total function.
From a reimbursement point of view, yes, but from a physical therapy point of view, the backbone of physical therapy is evaluation and reevaluation. So these objective measurements are extremely important, not from a reimbursement point of view, but from a documentation point of view. At the end of the day, they'll go hand in hand with functional improvement. One won't happen without the other. But the functional improvement has to be demonstrated to be reimbursed. At the end of the day, if the insurance company contests a claim, if we can demonstrate functional improvement, we've done our job. We're not in the wrong. But we can't just say, oh yeah, you lost 5% body fat, but you need to document that you're now walking better, or you're able to drive to work if you have an hour-long drive to work. Assuming these are patients' goals, of course. So at the end of the day, it'll come down to the patient's goal, the plan of care, the objective measurements, the justification of the treatment, the documentation, and the functional outcome. So it's a cycle from top to bottom. We can't invent goals.
But the functional outcome doesn't increase healthy blend. That's not reimbursed.
It may be for some patients. It may be for the professional athlete. It may be for the professional athlete who needs to make sure he runs a couple of miles on the treadmill before his coach accepts him back on the field. It won't be functional, it won't be reimbursable for someone who's doing a desk job. As soon as his ankle pain is done, he's out. He's not eligible anymore. So at the end of the day, it'll come back to the patient and the judgment of the therapist.
If there is data to show that increasing the room, it will decrease the back. That's a question.
Yeah, right, and for me, when I think about it in my mind, and I'm justifying why someone's on the treadmill for their back,
Right.
for that reason.
Right.
And there is core strengthening going on overall, strengthening was something that we were talking about when you're doing any kind of upper body exercise as well.